Good afternoon, and thank you for joining us today. This media briefing is taking place at the Wisconsin Department of Military Affairs, where staff from multiple state agencies have been working out of the State Emergency Operations Center on the ongoing response to COVID-19. This briefing is also streaming live on the Department of Health Services YouTube channel. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Van Dijk. They will be providing an update on the important work that continues to take place at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in which their RSVP was received. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. I'm here to update you on the role of the Wisconsin National Guard and our State Emergency Operations Center as we continue to respond to the COVID-19 pandemic. The Wisconsin National Guard remains heavily involved in COVID-19 specimen testing missions. As the state begins to open, specimen collection will continue to be a vital tool to help state and local leaders make informed decisions regarding their communities as they manage and respond to this pandemic. We currently have 25 mobile test teams trained and actively performing this mission all over the state of Wisconsin. And today I'd like to announce a small but important adjustment we are making to meet the ever-changing requirements. We are dividing 3 of our teams into 3 squads each. They will be optimized for mobility and testing at small and medium-sized long-term care and skilled nursing facilities. To date, the National Guard has collected more than 46,000 specimens. I anticipate that the need for testing will continue, and the Guard will play a leading role in testing communities across the state. Additionally, our call center mission continues to grow, where 39 soldiers and airmen are assisting with informing residents of their test results. In some cases, local communities and health departments are notifying residents of their results at the local level, but our call center is designed to assist in sharing some of the burden if the local communities do not have the capacity to call everyone. To better meet the needs of Wisconsin citizens, we have added about a dozen linguists, including Hmong and Spanish-speaking soldiers, to the mission. The call center has placed nearly 20,000 calls with an 87% success rate. Test results are typically communicated 3 to 5 days after the specimens have been collected. Last night, I had the pleasure of having dinner with the mortuary assistance team working here in Dane County. This team is made up of Wisconsin Air National Guard Fatality Search and Recovery team members, otherwise known as FSERT, augmented by additional soldiers from Wisconsin Army Guard units across the state. What a great group of professionals working in the most challenging aspect of this pandemic, ensuring the dignified recovery and transport of Wisconsin decedents. In addition to the testing, call center operations, and mortuary assistance, we will continue to devote time and personnel to the many other missions that the Wisconsin National Guard and Wisconsin Emergency Management are accomplishing day to day in support of the state's efforts. Again, I appreciate your time today and look forward to answering your questions.
Thank you. Now we will hear remarks from DHS Deputy Secretary Julie Willems Van Dijk.
Good afternoon, and thank you for joining us today. At my first State Emergency Operations Center briefing, I told you some stories of the SEOC. I told you about State Patrol assisting clinics throughout the state by picking up test specimens and driving them to the labs. I told you about the DNR wardens who stepped up to serve as security for isolation facilities. I told you about collaboration between local public health departments, the Wisconsin National Guard, and the SEOC to provide testing and care assistance to long-term care facilities. It's a month later now, and I have more stories to share about the work the SEOC is doing, rising to the challenge of the COVID-19 pandemic and its effect on Wisconsin. These are the stories behind the numbers we outlined in today's press release about the CARES dollars investment in this work of the SEOC. First, we worked on response to the threat the virus posed. We took early and continued action to procure additional personal protective equipment. This has meant coordinating requests from the Strategic National Stockpile, as well as public and private sector partners. But getting the PPE is only the first part of the story. The SCOC also organizes the PPE and distributes it across Wisconsin to where it is most needed by our frontline healthcare workers and first responders. We also want to provide our healthcare workers with the tools and resources they need most to care for COVID-19 patients. And one of those tools is ventilators. So far, Wisconsin has purchased 42 ventilators. We have ordered an additional 1,500 more and expect delivery to start this month. With only investigational medications and no vaccine, we know supportive care like ventilation can be a lifeline for patients with severe disease. Back in March and April, the data suggested we were likely to exceed our hospital capacity. Working with local health systems in Milwaukee and the Army Corps of Engineers, and with the support of FEMA, we built an alternative care facility on the grounds of State Fair Park in Milwaukee County, and another at the Milwaukee House of Corrections, which will open this week. We continue to support these facilities with the wraparound services needed to care for patients, like transport, electronic medical records, and lab and pharmacy services. Second, we have worked on strategies to contain or box in the virus. This line of our work is critically important as we venture out of our homes for work, shopping, and social connection. The first element of containment is the story of our testing capacity. We went from a lab capacity of 0 in March to a lab capacity of over 13,000 tests today in mid-May. Funding will continue to support testing all across Wisconsin through grants to local and tribal public health departments, as well as by providing free test kits to those departments, nursing homes, hospitals, and clinics. In Wisconsin, if you need a test, you can get a test. Please, if you are experiencing symptoms of COVID-19 or you have been exposed, call your healthcare provider and ask for a test. You can also find information about community testing sites on our website at www.dhs.wisconsin.gov/COVID-19/testing. Contact tracing is a phrase that is new to most of you outside the public health world, but it's the bread and butter of local and tribal health departments. Testing without tracing is meaningless. Once we know who is infected, we must contact them, make sure they understand how important it is to isolate until their symptoms have resolved. We must also notify all contacts to a positive case to quarantine during the period when they could develop symptoms. This is how we box in the virus and protect all of us, especially those most vulnerable to serious illness. Working with our local health department partners, the SCOC is building a system of contact tracing on a scale we have never seen. The funding announced today will support both local and state health departments in this effort. The work we do here at the SCOC is to keep Wisconsin as safe and healthy as possible. Thank you for partnering in that work with us, and please continue to practice physical distancing, to stay home and limit your trips as much as possible. And remember to wash your hands and don't touch your face.
Thank you. At this time, we will open the line to questions. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we will be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you've asked your question, we please ask that you remute your line using *6 again. We will begin with Scott Bauer from the Associated Press.
With this call again. Julie, I guess I had a question for you on the spending that was detailed just a little bit ago. It looks like this is mainly just putting some numbers to work that has been ongoing by the department and others. Could you kind of detail what, if anything, is new in what is being described here? And also, I just had a question on the $440-some million for surge protection. Can you talk a little bit more in detail about what exactly that money is being used for?
Certainly. So you're absolutely right, Scott, that this is detailing the investments of funding on work that we have been doing since we began here at the SEOC. What is a little bit different today than previously is we're putting a little bit more detail on this. We're being clear with our local partners about where the division of funding as well as the division of labor is between the state resources and local resources. So for example, in contact tracing, we've been meeting with local health departments, and they've said, rather than have the state hire all the people, let's build on the strong local system we have. And we've listened to them and want to support that, with the state serving as their backup and surge capacity. So more detail. The $440 million that you see discussed about surge is really looking at both the ability to operate the alternate care facilities if and when we need them, and recognizing that this is the funding we have until December 31st of 2020, and knowing particularly in the fall we may face a surge of COVID-19 patients if this epidemic follows a similar course to prior epidemics. We want to be sure that we have funds in reserve for any future surge that emerges.
Thank you. We'll go next to Addie Bink with WFRV.
Hi, thanks for taking my call. I was just wondering if you could explain a little bit what the process is like for a community testing facility opening up in a county or a city. You know, is it the local government kind of decides, or DHS helps, or is it joint decision?
You want me to start that, or you want?
Sure, you can start now.
All right.
Jump in.
So the process of setting up a local community testing site generally starts with a request from a local community. This is the way emergency management happens in our state. Local communities identify needs, see if they have the resources to meet those needs, and when they need additional resources, they contact the State Emergency Operations Center. So they make a request, we contact them to discuss the request, and we hold a planning meeting with all the relevant parties, members of the National Guard, members of Wisconsin Emergency Management, members from DHS, and then local partners, usually the local health department, the local emergency manager. Often local health systems participate in that call, so that all the parties who would be involved in the process of setting up the local site and following up on the results. Remember, if we go in and test a significant number of people in the community, we not only need to notify patients of those test results, as the Major General has described, but we also need to make sure there's contact tracing available to follow up on those results. And from there, we pass it off to the National Guard, and Major General Knapp can tell you what happens.
So after that, once it's determined that it will be a National Guard mission, then we have a team, we call it an ADVON team or advanced team, that would go out to the site, usually a day or two prior to standing up a community site, and work with the local authorities, whether that's to include the public health, emergency managers, all the ones that the Deputy Secretary mentioned. And then that's when we would actually diagram, if it's going to be a drive-through testing, how the lanes will be set up, how many lanes there'll be, where will the walk-up occur, and other wraparound services that we would need in order to sustain that test site.
Thank you. We'll next go to Sean Kirkby with Wisconsin Health News.
Hi, thanks for holding this. I was wondering, I believe the state had received $1.9 billion in federal funding under the CARES Act, and they've announced that you was about 1.2 of that. Can you elaborate on what the other $700 million is going for, and does any of this need legislative approval? Thank you.
I believe the governor's office will be making announcements about those additional dollars in the coming days.
All right. Next, we'll go to Ryan Curry with NBC 26.
Hi, good afternoon. Thank you for taking my call. My question is about the community testing sites. Is there any sort of plan to maybe extend those testing sites or expand to have more of them as the state starts to reopen with some businesses?
Thanks for the question, Ryan. In terms of the community testing sites, we're always looking for areas where we can assist the local authorities wherever they might have a requirement. And so, yes, we're in a lot of different discussions on a daily basis, projecting out additional community testing sites across the state. Once a community testing site is stood up, usually it's for a finite or defined amount of time. However, we have had a couple instances where we had 3 or 4 days scheduled at a particular site. And when we realized that the demand was continuing beyond those 3 or 4 days, we were able to adjust and extend for a few more days or the number of required days in order to test the maximum number of people that we could in that engagement.
And I would add to that, we are early in our ventures into how to do community testing. It really has been in the last month or so as we've built our testing capacity and had this great partnership with the National Guard that we've been able to initiate these community testing sites. They're both giving us really valuable data about the prevalence of the virus in communities across the state and also helping identify patients who need to be in isolation and their contacts in quarantine. But we know the National Guard won't be able to continue to provide this service for 2 years of the pandemic if it takes that long to get to a vaccine. And this is a service we'll need to continue to conduct in order to be sure we're protecting the citizens of Wisconsin. So as you heard, part of the money is not only going for testing supplies and test kits, but it will be going to our partners across the state to help us think through what is the strategy long-term about how we can sustain testing in communities and how can we support this kind of community testing over and beyond what our great friends at the National Guard are doing.
Thank you. We'll next go to Ricardo Torres with the Milwaukee Journal-Sentinel. As a reminder, *6 to unmute your line.
Sorry about that. Thank you all for hosting this. I have a question about the number of contact tracers. The governor wanted 1,000. I believe several weeks ago we were at around maybe a little bit more than 250. I'm wondering where we're at now and how many people are being trained.
Great question. We are currently this week have added 30 bilingual contact tracers that we are starting training. We have another 100 on deck that we will be adding. And as I mentioned, we've been working very closely with our local health department colleagues. And so we are in the process of assessing how many contact tracers they have and want to add at the local level to add to that 1,000 number. So while we initially may have implied that all of those contact tracers would be hired at the state, upon further conversation with our valuable local partners, we are looking at a combination of local contact tracers and state contact tracers to meet that goal.
Thank you. We'll go next to Stephanie Fryer with WISC TV Channel 3. As a reminder, *6 to unmute your line. We'll move on to Alex Moe with WisBusiness.com.
I know that the actual testing numbers for COVID-19 in Wisconsin are still not reaching the state's full testing capacity. And I'm wondering, why is that, and how can the state increase the number of tests being performed?
I think there's a couple of reasons why that is, and probably more that will emerge over time. First of all, as I've talked with people, sometimes people don't know who needs to get tested. people across Wisconsin remember the days when tests were limited and we were saying only if you have symptoms like a fever or a cough or difficulty breathing should you be tested. We now, with our additional testing capacity and more understanding of the symptoms of the disease, have expanded that list of symptoms to a much larger list, including those original symptoms, but also just feeling feverish, feeling body or muscle aches, having a sore throat, having a headache, having a new loss of the sense of taste or smell. All of these things, if you have new onset of those symptoms, we encourage you to get tested. COVID-19 can start as a very mild illness, and for many people, it stays a mild illness. But you, even with a mild illness, are a risk to everyone around you. And I know nobody wants to be the person that infects their grandmother or their grandfather or their neighbor with diabetes or a person undergoing cancer treatment whose immune system is suppressed and be the reason that that person gets very serious illness. So we're all in this together. So even with very mild symptoms, we are encouraging testing either at a community site or at your local healthcare provider. And again, if you test positive, asking you to stay isolated until those symptoms have resolved and you are no longer infectious. We're also working with all of our key partners to help everybody understand that this is important and part of the containment of the disease. So it's about how we set up the system so that we can test more aggressively in places like work sites, in congregate settings like long-term care. We've had great response from nursing homes across the state responding to the call of testing their residents and their staff. And this isn't just a one and done. These are systems that we will have to repeat over time because the virus doesn't know I was tested once and then therefore I'm okay. I can continue to be exposed. So we anticipate many people in our state will have multiple tests before the day that we have vaccine and can assure immunity.
Thank you. We'll hear next from Riley Vetterkind with the Wisconsin State Journal.
Hi, thanks for taking my call. So I was asking about hospitalizations. The number of positive COVID-19 cases has continued to increase in the state, but the hospitalizations, at least according to the data I've looked at in most regions, appears to have kind of flatlined or at least stayed pretty steady. Can we conclude from this that the disease or the severity of the disease wasn't as bad as feared, that it may be safe to begin reopening, or is that a flawed assumption? Thanks.
Well, I'll say a couple of things about that. We are testing a much larger portion of the population. So as compared to the early days of the epidemic when we were primarily testing people who were very sick, often already hospitalized, we're seeing a different array of people with COVID-19. So I think particularly with our expanded community testing efforts, we are testing a larger portion of the population and identifying people with milder illness who are less likely to be hospitalized. In terms of safety of reopening, our Badger Bounce Back plan identified a number of criteria that would be an indicator that it is safer to start reopening. And we have seen promising results recently in a number of those indicators. However, they haven't all been at that same promising level on the same day. So we're moving in the right direction, but we need to continue to test to be sure we're not missing pockets of COVID-19, and we need to continue to monitor those hospitalization rates. One of the things that I think it's really important for us all to understand is when our hospitals start to fill up with COVID-19 patients, it's too late to take effective mitigation or containment efforts because that, when the hospital is full, that's 3 to 5 weeks often behind when we've seen the rise in infection. And so watching those infection rates, watching those case rates, and especially in light of increased testing is really the earlier warning signs we should watch for about any concern about resurgence.
We'll go next to Will Cushman with WisconText.
Hi there. Good afternoon. I have a question about the potential for, as you mentioned, a fall surge or just a surge in cases at any point. I'm wondering if what sorts of contingencies there are in the case that a surge is so severe that it may overwhelm even a surge in contact tracing, and whether there are other measures the administration would consider taking in light of the Supreme Court's decision last week.
Well, I think one of the most important things that we are doing in response to the Supreme Court decision and this opportunity to open up Wisconsin is to speak directly to the people of Wisconsin. And you all have been incredible over the last 6 weeks under Safer at Home. People have honored that order. They have stayed at home. They have limited their social contacts and their errands and trips out of the home. And we know this from watching cell phone mobility data. And just because the order is lifted does not mean that people have to change their behavior dramatically. I do understand some people may need to go to work now that their employer is open. And we've provided guidance through the Wisconsin Economic Development Corporation about how employers can employ best practices to protect employees in their settings. And we still strongly encourage people to hang close to home, to limit the number of people in your social circle that you are seeing on a regular basis, to avoid any large gatherings. Those can be incredibly dangerous places for super spreading of the disease, to wear masks when you're out in public, and to be vigilant about hand washing, face touching, cleaning surfaces, avoiding commonly touched surfaces. And we know the people of Wisconsin and the employers of Wisconsin are all highly committed to the best practices we can all do to continue to reduce risk, whether there's an order or not. In addition to that, that's why we are working so hard on increasing testing and increasing contact tracing. You know, we had over 3,600 people apply for contact tracing jobs. We're working closely with our local health departments and increasing our state supply of employees who can do this. We've trained state employees to do the work who will be available for additional surge if we face that in the fall. And so we're keeping one eye on how can we all work together to maintain physical distancing and good practices to avoid a huge surge, and then how do we set up the systems to be in place in case it happens.
We'll go next to Shemaine Mills with Wisconsin Public Radio.
Hi, thanks for taking the call. When the state had restrictions before the Supreme Court ruling, you had a predictive model of why they were needed. Now that those restrictions are gone and it's up to locals, I'm wondering, do you have any predictions on how the pandemic could go in the future? Any modeling that you have?
Yes, Shemaine. Many of the models that we looked at in the last few months were predicting what would happen when we lifted the restrictions. And I think this is the critical piece about this virus is while we all stayed home, we didn't become immune to the virus. And the virus didn't become any less lethal. So this is why this strategy of extensive testing and contact tracing is so important as we open up. Because if we simply open up without attending to finding the virus and boxing it in through contact tracing and isolation and quarantine, we will see likely see a sudden rise in illness because the virus is still circulating. It preys upon people who don't follow those kind of restrictions, and we'll see a rise in disease. And that is why when we issued the Badger Bounce Back Plan back in April, we said we need another month of social distancing, and we need to be standing up these systems so that we can do further containment. In South Korea, they are testing and contact tracing at a level far above what we've even aspired to with the 85,000 tests per month. And they have largely been able to contain the virus from resurging. We are attempting a similar approach, and the better we do, the fewer cases we'll have. The worse we do, both with everybody's choices and our containment strategy of testing and tracing, the more cases we'll have. So let's do it together, Wisconsin. We have it in us.
We'll go next to Elise Romas with NBC 15.
Hi, I have two smaller questions. There are some rumors I've been reading about and hearing about from people I know in the healthcare world about the accuracy of some of these tests and how sometimes it's early on with somebody not showing symptoms, but they might have COVID-19 and they don't always test positively for the disease right away. So I'm wondering if any of those rumors, if that's true, if that happens with the test, or how exactly accurate these are. And then I'm just curious of what information you guys can give us with as far as treatments go for the virus.
So any laboratory test is going to have some level of false positives and, as you described, false negatives. The tests that we are using, the nasal or nasal pharyngeal swabs, are very accurate. They will detect very small amounts of virus based on the laboratory technique that is used. However, I think this is something that's really important. I'm glad you asked this question. One negative test does not mean you will never have COVID. And if you have a negative test, if you have mild symptoms, you could have gotten a test very early in the illness. There wasn't enough virus there. It wasn't picked up by the test when they ran the sample in the lab. And if your symptoms continue, it's important to go back and get another test. And having a negative test does not protect you against COVID-19. And so, again, as I said earlier, many of us may need to have multiple tests over the period of time until we have vaccine and have proper protection against this illness. In regard to your question about treatment or medications, right now there really are no clear medications that we know are effective against COVID-19. There are several drugs that have FDA approval for experimental use. Remdesivir is one that we have recently distributed in the state, but these are still under what is called an investigational use. So we're learning by people who use them, and there is no clear treatment that we know works effectively for most people.
We'll go next to Will Keneally with PBS Wisconsin.
Sorry, can you hear me all right?
We can.
Wonderful. Thank you again for doing this. I wanted to go back to something that you touched on a little bit with the long-term strategy. I've seen some reporting in Politico that the federal deployment of Guard members could end as early as June 24th. I was wondering if you'd heard anything about that, or if you could otherwise describe what the end of a federal deployment might look like.
Yes. So I also saw the political report, and what that's describing is the end of the current authorization by the White House to use Title 32 federal activation for National Guard forces. So that's through right now in Wisconsin. We are approved through the 24th of June. I would like to note that the governor has made an official request to the White House, along with other governors from other states, to extend our mobilization or our ability to stay on orders through the end of July. That has not been approved yet, and we're waiting for that. In terms of what the end of a mobilization would look like, we're working right now in order to try and work out those details. There's a lot that goes into unwinding all of the programs that we've set up. One of them is trying to hand off any of the workload that we've been doing in the National Guard to other departments or civilian authorities. And that's one of the big reasons why that initial allocation of the CARES funding is going out to help with community-based testing. So things that we would consider in terms of post-deployment or winding down the deployment would be one of the things that we have to consider is that these Guard airmen and soldiers have been earning 2.5 days of leave or vacation per month that they're on orders. So we have to build that in to the timeline. And there are a number of other things that we take into consideration and have to backdate that the end of the orders as well.
As a reminder, after you've asked your question, please remute your line by hitting *6 or manually muting using your phone's feature. We'll go next to Marty Glaser with Spectrum News.
My question was just asked. Thank you so much.
Thank you. We'll move on to Jeremy Janine with Urban Milwaukee.
Milwaukee Secure Detention Facility testing. Is that for everyone in the facility? Is it something that will happen at every state correction facility? I saw it in the Guard press advisory.
Okay, I'll take the first crack. I think that was Department of Corrections testing was the question.
Secure Detention Facility.
Oh, okay. The Milwaukee Secure Detention Facility was tested. We did that as part of a Wisconsin National Guard mission, and it was 100% of the staff as well as the people in custody. In terms of additional Department of Corrections testing, we have completed testing on a handful of I think it was 2 or 3 Department of Correction facilities that did have current positive cases, either with the staff or the people in custody, meeting our criteria at the state as an outbreak, and so we went out and tested those. We are in planning right now with the Department of Corrections, like we are with other agencies that have congregate care facilities, in terms of setting up 100% testing across the state. That will be a very large effort. As you know, the Department of Corrections has I think approximately 37 different facilities, so that'll be a long-term plan that will go well into the summer.
Our last question will come from Danny Maxwell with WKOW TV.
Hi, thanks for taking my call. I wanted to ask the general or Julie about the testing of the Alliance Energy Center in Madison. How the demand has been, the traffic has been, if it's winding down or if it's not, and depending on the demand there, how long the National Guard is expected to keep that community testing site open.
Okay, great. Excellent question. This is a good example of one of the testing sites that we actually have for a long-term duration. We've planned to keep that test site up at the Alliant Energy Center for the foreseeable future, and you kind of hit the nail on the head in terms of demand signal. And we're closely monitoring demand signal at all of these sites, in particular the Alliant Center and then the 2 community-based testing centers we have set up in Milwaukee. Yesterday, or in the last 24 hours, we accomplished 699 tests at the Alliant Energy Center. So that definitely is showing a steady flow of demand there, and so I don't see us taking that facility down anytime in the near future.
Thank you. That concludes today's media briefing. As a reminder, you can always access the latest updates on the state's response to COVID-19 by going to the Department of Health Services website. You can also find additional information about the state's response through the websites of the Wisconsin National Guard and Wisconsin Emergency Management. Thank you for joining us today and for your questions.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes, with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate, WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.